These are evidence. So my talks should be based on established evidence. The other one is gerontology, the multidisciplinary study of all aspects of aging. Now, at present time, more than 10% of the population are old people. And gerontology is the branch of study that studies different aspects of aging, including health, biological aspects, sociological, psychological aspects. It is gerontology. We have also geriatric dentistry or geriatric medicine, the medical branch of medicine that is related to aging or old people is geriatric dentistry or medicine. Yes, George? After 10 minutes. Patient, when he enters the office, then ask him to sit, then take the history, and then ask for chief complaint, then take radiograph, then find the place that there is a decayed tooth, then take your handpiece, put the drill, one after one. These are steps to treating, and then at the end, say goodbye to the patient and ask for follow-ups. Come back for next 2 weeks to check the condition of that filling. All of them are steps for treating a tooth. It is named guideline. One by one, you write steps. Sometimes these guidelines might be presented by a figure, or sometimes the teacher takes your hand, drill like this, not like that. All of them are guidelines. So any direction or principle representing current or future rules or policies of a clinical practice is named guideline. So the guideline should be very comprehensive and it should be very comprehensive from the beginning to the end of a practice, from the stages before the beginning to the stages after the end of the practice should be covered in the guidelines. So, and guidelines are very specific and more detailed on the steps of the activity. Health. Did Dr. Hamid talk about the health lessons? Yes? Okay, I understand. The other word is health behavior. There are, that is a very big range of activities that are named health behaviors. Brushing is kind of health behavior, or exercise is kind of health behavior. Any activity undertaken by an individual, regardless of actual or perceived health status, for the purpose of promoting, protecting, and maintaining. There are 3 levels. Maintaining means keeping at the level, protecting is before that, and promoting is after. So first is protecting, maintaining, and promoting. These are different levels of health. Sometimes protect people from the disease, then try to maintain the health level at a specific level. Sometimes we try to promote. How can we imagine that? About 50 years ago, the life expectancy of many countries was between 60 to 70 years. Now, life expectancy of many countries are between 60 to 70 or more, 70 to 80. So that's an example of promoting health status. Or 50 years ago, the number of adulterous people was, for example, about 10% of all the population. But now, in many countries, the percentages of adulterous patients or people are something between 2 to 3% of the whole population. So that is an example of promoting health condition. And indicator. What is health? Are you healthy? Are you healthy? Are you healthy?
Yes, we are.
Are you healthier than her? Are you healthier than her? And can we measure health? Yes, we can measure. For example, number of teeth present is an index for oral health. Number of people here for a dentition without any filling, full health, is an index for health. And there are so many indicators for health of a population. The other word is risk factor. Risk factor. What is risk factor? Imagine that a mother have a fetus and she is pregnant, but she has not enough money to she has to work every day, so she has not enough time to rest. So that is kind of risk factor. Or if a mother has gingival diseases and calculus in her mouth, there is a risk of preterm birth for that mother. Might deliver her baby earlier. That is, this relationship is established and it is an evidence. So calculus is a risk factor for preterm birth. So there are some health risk factors. And illness discussed. Life expectancy means the number of ages is expected a group of people live at the point of birth. Life expectancy has a specific method of calculation that needs several numbers that you can calculate the life expectancy of a population. But the point is that this number is for expectancy at the birth, at the age 0. The other one is lifestyle. Actually, lifestyle is introduced in years 1950 to 1970, about 50 years ago. And what is lifestyle? Is a set of habits or customs that is influenced, modified, or encouraged by the lifelong process of socialization. Actually, all of our habits or my wife is teacher in primary level.
Teacher, what's this crowding?
She teaches Persian at level 2. And she has taught for 10-15 years. She says that this year I have students that I talk to them. I ask them to sit when they are in the class. But I say them, don't speak 1 time, 2 times, 3 times, 10 times, but they speak together. And ask them to sit, don't run, don't walk in the class. The seats are for sitting, but they walk. Level 2.
Give them a negative mark.
It has no effect. Okay. Lifestyle, that is a set of habits or customs. Each of us have our own lifestyle. And these lifestyles sometimes have effects in your health condition. Some of the health behaviors might be a lifestyle. That health behaviors are part of the lifestyles. For example, exercise or smoking, some of these lifestyles might be dangerous or life-threatening or a risk factor or life-protecting. So lifestyle might be risky or protecting. The other one is nutrition. The process of nourishing or being nourished, especially the process by which a living organism assimilates food and uses. As also the science or study that deals with food or nourishment, that is nutrition. And the word prevention. What is prevention? Preserving and maintaining and promoting health. Restoring health when it is impaired. There are different levels of prevention. Sometimes we want to protect from the disease. Sometimes the disease starting to happen. Then we try to minimize or start to treat the disease. But sometimes the disease happens and has some impacts. Then we try to recover the impacts of the disease, but cannot recover it fully. So different levels of prevention. Actually, there are 4 levels of prevention. There is primary prevention level. The protection of health by personal and community-wide effects. And there are also some measures that prevent from the onset of a targeted condition. So, secondary prevention, what is that? Secondary prevention measures the the condition that identify and treat asymptomatic persons who are already, for example, when we have a decayed tooth and we treat it, we feel it is an example of secondary prevention. And when we have a missing tooth and we make a prosthesis, then the individual have the prosthesis and can eat like before, but that is not exactly the same as he has his own teeth. So it's, but sometimes have pain, sometimes food is behind the prosthesis, and sometimes has problems and goes to the doctor. So this is the tertiary prevention. We name it tertiary. But there is another thing. For example, this is kind of tertiary because I can watch, but I have problems. And there is another one, primordial prevention. Primordial prevention is when we try to minimize or control risk factors. For example, in the health centers in Iran, there are some people who visit the health center. For example, they have babies and goes to health center for mother and child services. But the physician or the nurse there sees that this family is not in a good socio-economic condition. So there are some coupons, some places for helping that family, to help the family, to give them some basic facilities or conditions to help them to have a better condition, a better socio-economic condition, to protect the family and also protect the baby for having a better nutrition, better growth. The baby is healthy, has no disease, but to protect the family, they help them socio-economically, or sometimes they educate them how to live better, how to manage their problems. So that is a primordial prevention. For example, here is another example. In adults usually have hypertension or obesity. But if you educate the people to have exercise in childhood, in schools, for example, have the class or time for exercise and educate them, these help them to have a better health condition in adulthood. So that is kind of primordial prevention. Morbidity. And another one is mortality. morbidity is deviation from normal condition. So any deviation from normal condition, physiological or psychological condition, named morbidity. And the other one is incidence. When a disease happens in a population is named incidence, and the number of cases, new cases of disease happen in a specific time period is incidence. And usually is reported in the 1,000, for example. But if the disease is very rare, then we report it in 100,000 people, or sometimes in 1 million, but usually 1,000 we report. Is a number of events, conditions, and disease prepared, but in a time period, but not number of new people, all the people, new and old conditions or events during the time, a particular time. And sometimes you name it prevalence rate also. We can report it in different ways, sometimes by percent, or sometimes by reporting in 1,000 of the basic population. Population pyramid, we have a branch of knowledge, name it demography, that studies the conditions and methods of studying the population characteristic. And later on we probably have some a chapter of the course book that I wrote is about demography. And the population pyramid is a graphical presentation of the age and gender composition of the population. Demographic characteristics means all specification or characteristics that an individual has and cannot be separated from his or her. For example, gender. For example, age. Or you travel to another country. You live there some years. But if you stay in that country for more than, for example, 10 years, then you have all characteristics or behaviors or lifestyle of the new community. Then you might, for example, somebody are born in villages but travel to the cities. After years, when you ask them, where are you from? He says, I'm from that city. So he has turned to an inhabitant of that city. So the demography of that individual is now the resident of that city. Yes. We have some words such as sporadic. It refers to a disease that occurs infrequently and irregularly. sometimes, for example, in autumn or winter, this disease happens, but not so much. But endemic refers to a disease or condition to the constant presence. It means that every winter this disease happens. So there is a constant occurrence of the disease or infectious disease or agent in a geographical area. So the geographical area is not widespread in the whole country, a specific place. Name it endemic. Hyperendemic refers to persistent high levels of disease occurrence. Occasionally, amount of disease in a community rises above the expected levels. For example, in winter time, you see that a specific disease or flu happens in a city higher than normal amount of number of people in winter time. For example, in the previous years, you see in this year there is an increase in number of people disease. So we name it hyperendemic. And what is epidemic? Refers to increase, often sudden, in the number of cases of a disease above what is normally expected in the population or area. So it's wider than before. So outbreak is a safe definition, but is often used for a more limited geographical area. And pandemic refers to epidemic that has spread several countries, more than one country or area. So this is pandemic. And there is a word cluster. When we want to do a study in a population, we have to select the samples or subjects from different parts of the population. So we clusterize or select or divide the population to different branches, and then from each cluster we select 1 to 10 samples. So, for example, this class is a cluster, the other class is a cluster. If we want to have an interview about the educational status, the international campus of the dental school, we can select 5 people from this cluster, 5 people from the other cluster, that other cluster. Each of you might be as a cluster. Okay, you can read other parts of the. Okay, that is this part of the